You're listening to 419 Education and Training Need to Connect podcast. Hello, everyone, and welcome to another episode of Need to Connect podcast. I'm your host, Devonna Willis with 419 Education and Training and the founder of the Black Massage Therapist Conference. And right now we have Mr. Mark on the call right now or on the video because he is going to be teaching cupping at the conference. But Mark has vast information in regards to the body, and he is a registered massage therapist in Canada, and he's coming all the way down to the States to teach you guys. And I want Mark to introduce himself and give a short bio of what you do and who you are.
Sounds good. How are you guys doing? My name is Mark, as Devon had mentioned. I'm a registered massage therapist in Toronto, Ontario, Canada. I'm also a registered kinesiologist. Kinesiology is regulated in Canada. We're in the only province in Canada that's where I think kinesiology is only regulated in this one province in all of the world. So it's kind of a cool thing for anyone that's graduated with a kinesiology health science degree that you are a regulated healthcare practitioner where I am. I run a continuing education company called ConEd Institute, where we do in-person and virtual classes. I'm also the co-host of Two Massage Therapists in a Microphone podcast. I am part owner of the Canadian American Massage Conference, and I'm also part owner of our newest business venture, Massage Therapy Media. I'm thrilled to be coming down to teach cupping to an awesome group of therapists. I was there last year hanging out, doing some video footage for you guys, which was fabulous. And I'm so excited that you've invited me to come participate in a teaching capacity this year.
Absolutely. So obviously, if you didn't know, this is the other guy on the mic. So he's a professional. So I said, Mark, do not judge me. This is still new to me. Okay. So don't judge me as this is like my first real podcast that I'm doing. So
Far from professional I am.
So obviously you see how amazing he is. So if you guys don't know, there was an American Massage Therapist Conference prior to, I think, 2019, right? It stopped or right before COVID, right?
That is correct.
Okay.
And so I've joined up with the Canadian and American Massage Therapists team. So they had a little bit of a rearrange of the partners, and myself and my wife, who is also a registered massage therapist, Amanda, we joined on in 2019, 2020, and we've been going strong with some virtual conferences and in-person conferences so far here in Canada.
Awesome. And they invited me to the Canadian Massage Conference this past June. It was my first time going there, and it was amazing. I enjoyed myself. There's some tips that I took away that we'll probably incorporate in our conference. I'll tell you about that. And also the American Massage Therapy Conference will happen in 2025 in what, May?
Yes, May 2025 in Orlando, Florida.
All right.
Oh.
Well, I'm planning on being there. So
right.
Amazing. So let's get down to some questions here.
All right.
Now, you guys, Mark is of mixed race and descent. So he has knowledge about how it is in Canada. So right now, a lot of our therapists are in America or maybe the Caribbean. But because you're in Canada and being, mixed race, how is your experience in Canada compared to how it would have been in America?
So I think one thing that we all have to recognize is I'm in a very culturally diverse city. Toronto is like one of the most culturally diverse cities in the world.
Nice.
My experience being of mixed race ethnicity might be really different simply because I'm in this multicultural hub of Toronto. So being outside of Toronto is actually really, really different. I just recently, for the conference in Calgary, all of our conference partners, they jumped on a plane, and I don't mind flying, but I also had a whole bunch of equipment I was taking.
Mm-hmm.
So I drove, and it was about a 2.5 day drive. It was 36 hours. And that is driving all through northern Ontario and then driving through Manitoba, Saskatchewan, and then into Alberta to get to Calgary. And so you can really see, the cultural landscape change dramatically
Oh,
as
really?
soon as you leave the metro part of Toronto, right? Even 3 hours north of Toronto, it is very different and very less colorful. And then you can imagine as I'm driving through the prairie provinces, which is really all just farmland, it is completely not colorful at all. So my experience in Toronto has actually been quite positive,
Okay.
simply because of vast cultural diversity that happens.
Mm-hmm.
But because of our podcast, we've had many therapists on from all parts of the world and all
Mm-hmm.
parts of Canada. And, they speak of something a little bit different, right? We've had yourself on, we've had your partners on, we've also had other Black therapists on from the States and different parts of the world. And, when someone's canceling an appointment because they booked online and they didn't recognize that their therapist might have a little bit of pigment to their skin, and then they show up to the appointment and they recognize it, and it's like, ooh, I don't want that. I don't want this treatment anymore, and they
Right.
decline and walk out the door. Those are experiences that I think a lot of people should hear about.
Mm-hmm.
I have had tons of experience with that, but mostly again because of where I'm located. But I can totally empathize with someone that goes through that type of experience.
Okay, cool. So with the percentage being in Toronto, so my goal is to be in Toronto next year.
Nice.
We're gonna figure this out. My goal is to be in Toronto next year. But being in Toronto versus Calgary, right? So this is my second time going to Canada, right? So remember I messaged you like early this year, went to Vancouver. Vancouver too, to me, was diverse.
Mhm.
It had more so a lot of East Indian,
Right.
right? In Vancouver, Calgary didn't seem as diverse. It had, for me, it had more, well, it had more Asian. And I wasn't expecting that.
There's a larger population of Asians in Calgary, and Vancouver actually has a quite large Asian population as well.
Okay.
But Toronto is just a different beast,
Yeah. It's like
especially
New
where
York City, right? It's like New York City, like the
it's like New
melting
York
pot.
City. Exactly. And it's like where I'm in Toronto, I'm in the east end of Toronto. I'm in Scarborough. And
Mm-hmm.
Scarborough is one of the larger multicultural hubs. Like any type of food you'd ever want to get, Scarborough is the place to be.
Mm-hmm.
Any type of faith worship you want to come across, Scarborough is the place to be. So I live in like this really kind of multicultural center. And that
Okay.
was one of the biggest pulls for me actually staying in this area. Right. So when I've had opportunities to move elsewhere with my family and everything else,
Right.
we've always come back to the idea we want our children to grow up being around a culturally diverse population of people,
Mm-hmm.
right? That's what we want our children to not necessarily see all these different types of separations. We want them to just see people as people. Their
Right.
friends are just people, whether they're East Indian or they're Korean or they're First Nations or whatever the case is. So that was a big reason why we decided to even stay here, keep our roots here, and everything else. And that also goes along with my background.
Right.
My parents are from Trinidad
Mm-hmm.
and Tobago, so I'm really mixed. There's Black there, there's Chinese there, there's French, there's Dutch. Like I'm a nice mix of a little bit of everything. So I just kind of wanted to keep that going with my children to have that large exposure to it. So it's not just they get it at a family gathering, right? They get it in their everyday life.
Right.
So yeah.
How often do you visit the Caribbean, the Trinidad or Tobago?
Oh man, I haven't been there for a while simply because my father wasn't doing well the last couple of years before he passed away,
Okay.
and he was my Trinidad travel buddy.
Got
So I haven't been there in a bit, but I was actually just speaking about this the other day to my mother because we do have some property there, and I was like, yeah, I think I need to go take a visit very, very soon and go catch up with everybody.
For sure. And take the whole family.
Absolutely, yeah.
Yeah, for sure. All right. So another question I have is if a therapist from the States said, wow, I'm really interested in, relocating, I want to feel that sense of community. What would you say, what would they have to do to kind of visit if they can, if they wanted to come there and live there and reside in Canada or Toronto?
Work as a massage therapist in
Mm-hmm.
Toronto. Okay. So because Canada, there's of all the territories of the provinces in Canada, there's 5 regulated provinces,
Okay.
and Ontario is one of the regulated provinces. So our governing body is the College of Massage Therapists of Ontario, which is very similar to, say, like the College of Physiotherapists or the College of Chiropractors or the College of Physicians and Surgeons of
Right.
Ontario. So, in order for you to practice as a massage therapist in Ontario, you have to have your education done in Ontario at an accredited institution or the equivalent to an accredited institution in a different part of Canada.
Mm-hmm.
Uh, even if you've practiced or studied outside of Canada, you would still have to obtain, as far as I remember the regulation to be, you still have to obtain a diploma from an accredited school in Ontario or any accredited school across Canada. And that would grant you the opportunity to write your licensing exam. So the massage therapy licensing exam in Ontario and through the other regulated provinces, there's 2 parts to it. There is your practical examination,
Mm-hmm.
usually consists of several different stations. So, for example, in Ontario, the different stations are a client interview station, a treatment plan consent station,
Oh,
medial exercise station, a treatment station, a technique station, and there are 2 assessment stations. And that kind of looks very similar to the rest of Canada. And then there's also a written examination that you'd also have to
mm-hmm.
sit for that and be successful at that. So a combination of 2 successful examinations will then allow you to register to become a member of the College of Massage Therapists of Ontario. So it gets a little sticky for someone that's been licensed or has been educated outside of,
Mm-hmm.
and the massage therapy education in throughout the regulated provinces, but not just that, throughout the rest of Canada, with the exception of maybe Quebec. Quebec kind of just beats their own drum when it comes to massage therapy. But the massage therapy education in most of the regulated provinces, we're looking at 2,200 hours plus education, and that's the standard.
Mm-hmm. You hear that? 2,200 hours. Some
Yeah.
of you guys are upset that the state, well, not the state, excuse me, the government is trying to regulate the standard of schooling in the United States to be everyone's 650 at least. 650 because there's some states that only go to 300 or 500. Canada is 200, how many? I mean 2000.
1,200 hours, that's the minimum that most schools are doing now.
Right. And so that equivalent is similar to maybe getting an associate's degree here in the States. Is this a 4-year program, 3-year program?
So there's a couple different ways that you can go about it. So there are community colleges, so a college where you can do the program, and that normally takes about 3 years to do.
Mm-hmm.
Along with that, though, you have to take as many other courses to meet the community college requirements to have a community college diploma, right? So you'd have to take all your electives and all that kind of stuff.
Right.
And the other route that you can go to is going to a private career college or a vocational college. And so with that regard, there are no electives or anything that you'd have to take, right? It's just straight off go into the core curriculum. And that typically is about a 2-year program if you go that route. So when someone's doing that route of the private career college, that's typically when you're seeing someone that's maybe a little bit older, maybe a second career type of thing. Let's get in there. Let me learn how to do this massage therapy stuff and let me get licensed and start working. Versus a community college, I'll say. You're seeing someone that might more come out of high school, right? And they're like toying around with the ideas. Am I going to go to college? Am I going to go to university? And then what am I taking? So there's going to be a time difference, but mostly because of the electives that you'd have to take out of community college.
Absolutely. So let me ask you this. So I found it quite interesting. So when I was teaching, I did notice a difference in the education level. So when I was there at the conference and I was teaching, it was just a response and it was very different. Let me just put it that way. It was different. And it was noticeable to the fact that I told my husband, I was like, okay, it's a different level of education, which is great, It's just something I know, being an athletic trainer, being in the field for a long time, and I could see the difference when, teaching ATs versus LMTs and so forth. So with that said, so like if I'm teaching my sports massage class, I said there's tiers, right? So if we're in the orthopedic realm, so you have in the medical field, you have the orthopedic doctor first, right? So that's the first and foremost. Then typically with that, you might have their PA or, physician assistant or nurse practitioner who works with them. Then you have physical therapists, right? And then the chiropractor. And then you might have like a naturopathic doctor, and then the massage therapist. And in between there's an acupuncturist, right? But there's levels. And, and then the athletic trainer, excuse me. So after PT, it could be AT depending on, if it's a school, college, Division I, right? Because we're on that same level. We're treating the student athlete during that time, or professional athlete when they get injured or whatever. And so massage therapist is on the low end of the totem pole. For you all, based off your educational level, where would you fall in that tier if you had something similar?
Okay. So outside of the idea of sport, because we both know that sport's a little different, where your orthopedic sport doc is on top no matter what, right? And then there's a certain trickle down. When it comes down to massage therapy in general, in Canada, there still is this level of hierarchy, but it's really on a theoretical basis, it shouldn't be there. Because we're regulated, and we're regulated in the same manner under the Regulated Health Professions Act as a doctor, as a physio, as a chiro, as an acupuncturist, as a naturopath, as a registered kinesiologist. Like, all of these guys are falling under the same regulation or legislation or law, the Regulated Health Professions Act, which kind of puts everyone like on the same level, but obviously different scopes of practice and different skill sets.
Right.
That's the theoretical side. When you actually go out into the world and you're working as a massage therapist, we've done a lot of work, I feel, as massage therapists to be recognized as like, we're on level with that PT, we're on level with that chiropractor. And I think that's becoming more of a thing as the general public is getting to understand what massage therapy can do for them. And not just, I'm going to go in and I'm going to relax. It's not just a luxury. It's a skilled manual therapist that has a high level of education.
Right.
But there is a lot of that kind of ego hierarchy that you might see from, a chiropractor or a physiotherapist. But when it comes down to actual scope of practice, so much overlap in the scope of practice. And I'll just talk between massage in Canada, chiro in Canada, and physiotherapy. There's so much overlap that it really puts really kind of on the same level on a theoretical.
I like it.
But a practical standpoint, there's still a little bit of work. And I think that work comes with educating the general public about what massage therapy is about and what it can and can't do and what massage therapists do. And I think that also comes with educating the other healthcare practitioners. So does that chiropractor recognize that there is an overlapping scope of practice? Does that physiotherapist recognize there's an overlapping scope of practice? And therefore, we're not stepping, on someone's toes, or we're not reaching into someone else's lane by doing similar manual therapy work.
Okay. So do you, because in the States, I know we've heard the word masseuse. Is that word ever used in Canada?
It's used more amongst the general public that maybe not have had a visit with a registered massage therapist before.
Okay.
I don't really take offense to that word as much as other people might. But that's just me personally. I do recognize why someone might. It's like, no, I'm a registered massage therapist. I'm highly educated. I went to school. I did my licensing exams. I'm a member of a regulated college. So I get where that comes from. I'm just a little bit more laid back. And as long as someone really recognizes what we provide, what our value is, to me, that's just nomenclature, and that's a little bit of education can work around that. That's just my take on it. But I do recognize some massage therapists are really opposed to that type of language or those words, and they're really steadfast in correcting it immediately. I'm just a little bit. I'm a little bit more.
I'm one of those people.
Yeah. Well, it's really interesting though. because before there was the Regulated Health Professions Act in Ontario,
Mhm.
the College of Massage Therapists used to fall under the Drugless Practitioners Act. And with the Drugless Practitioners Act, the board of directors of massage at that time, their registration certificate used to say masseur or masseuse. And that's going back, I don't know how many years, 30, maybe 40 years. So, it's someone isn't really talking out of school if they use those words, but, time has changed, words have evolved, and especially using masseur or masseuse in this field, it's evolved enough that I can see where someone would be like, nah.
Right.
But we do have some not old school, retired massage therapists that remember the days when my certificate said masseur or my certificate said masseuse.
Wow. Okay. So let's talk about continuing education, because you are a continuing education provider. You and your wife have a whole institute. And so we have you coming in teaching cupping. So what made you get into cupping and being that, a specific niche that you really, one of those specific niche that you like?
When I first discovered cupping, it rapidly changed my practice. So when I'm doing cupping, or when I'm talking about cupping, and the cupping that I'll be teaching at the conference, is we're using cupping as a soft tissue tool. So we're not really looking at it from a traditional Chinese medicine standpoint, right? We're not looking at that type of medicine.
Right.
And so we're not looking at the idea of decongesting an area and removing toxins from the body and all that kind of stuff.
Right.
We're strictly using it as a soft tissue tool. And the prime purpose of using it as a soft tissue tool is to have a really cool effect on the nervous system, to create a lot of pliability within the tissue. And when you put those two together, affecting the nervous system, pliability to the tissue, that's going to mitigate pain. That's going to improve range of motion. And if that happens, that's going to increase motor output and functioning. And that's where I'm going with cupping course that we're teaching at the conference. Now, we are going to take a look a little bit about the more traditional use of cups and the traditional Chinese medicine kind of outlook on the use of cups, just so we have a really good understanding.
Right.
That way, anyone that comes in to see you, they might think of cupping to be completely different than what you're doing and using it as a soft tissue tool.
Right.
So, for example, there's a practice of cups where you make an incision into the skin and you place the cup onto the skin and it draws blood and fluid out of the area.
Yep.
That is something completely out of scope of practice. That is something that we don't do, but you may be, and I have, working in this multicultural city,
Right.
I've had people call and say, hey, do you do bloodletting? Because I saw on your website that you do cupping. Or we have people that call that want to take the course that, hey, do you do wet cupping? Do you do that stuff? Is that something? And so imagine now you didn't have that a little piece of knowledge to at least have the conversation to let someone know what this is and how we're doing cupping differently and what we're using it for. So we do touch on those things enough to educate the therapist so they can respond to those types of questions or inquiries.
Right. And you're not lighting the cups on fire either.
No. We're not doing the fire cupping, at least not in the class that we're.
Right. Exactly. So for your class, so you have 4 hours to accomplish the goals. And I know right now, just looking at some of the pre-registration, that is slowly filling up. So I'm excited about that. You're going to have a good cupping class.
Nice.
So tell me about in the industry. One of the questions I had is, what are some of the current trends in health and wellness that you think are particularly beneficial for specifically the Black community that may not know about it?
Honestly, I feel like it's just a general idea of overall wellness and embracing self-care and wellness. I think that goes something that needs to be brought out and practiced a little bit more amongst the Black community. I think that's really important. I think that there sometimes is also reluctance associated with, for lack of a better way of saying it, traditional forms of medicine. And I think that massage therapists because we kind of just sit outside of that very traditional form of medicine. We spend a lot more time with any of our patients and clients than any other health practitioner does. It allows us to, get in and be with a person a little bit more, meet people where they're at a little bit more in a non-rushed, non-judgmental, empathetic kind of way where communication can flourish. And to me, a lot of times that's where the real wellness can start. Right. And once real wellness starts, then you can see a lot of health conditions or lack of healthcare awareness that might be prevalent in certain Black communities. Well, now we can start to break some of that down with things like patient education and the embracement of being a little bit more self-aware and understanding the overall where wellness sits in the sense of things.
What would be a quick tip or something that they can do, like an action item that they can do, whether it's in their practice or if they're like doing mobile massage? What is something that they can do, quick takeaway that they can do immediately in their business?
Just general wellness information. So something that you might just have something as simple as a general health information that you constantly publish, say, for example, on your website. So if you have a blog, or if you have a video blog, so a vlog, or if you're having a lot of posting onto your social platforms, right? One thing that I always stress with any of the social platforms or any type of blog that you do is to constantly give value to your patients, your clients, your audience. So if you can identify an area where wellness may be lacking or education may be lacking in the community, whether it's the Black community or any other community for that example, and you recognize that there's a gap that's missing, then it's very, very easy for you as the educated practitioner to try to fill that gap with information. And so and that information would be of value to the audience member. And that, I think, is a great place to start. And that way, anytime someone has any type of issue, you can always just say, hey, maybe you should go check out this blog that I did, or maybe you should check out this post that I put up. And this might, give you some information about this condition or whatever it is you're going through, or it may not be you. It may be your sister, it may be your grandma, maybe somebody else. But that constant just overflowing and sharing of health information, I think, is so valuable.
I totally agree. So this past weekend, I was presenting at a conference. It was about the melanated skin, but it was more so business and sales, right? And one of the things I said is, to your point, having a blog, having a weekly newsletter, educating. I used to have clients sometimes come back and report back to me what they read on a newsletter.
Nice. Right? Yes.
And that's something, because you're giving them value. I mean, you're giving them value. And then they would, or we used to sometimes hand it out. When you're in business, you're pivoting. So I'm like, all right, we can't print all of these things all the time. So, or just have it in the lobby while they're waiting. But that information, people would read it and people would, internalize it or say, oh, I refer such and such because I know they had this problem that you just had on your blog or on your newsletter, right? So that information is really important. And I know, we're in the social media era, but just email marketing is still one of the best types of communicating with your clientele.
Absolutely. I love the idea. And I always would suggest as well, like, even when you're having casual conversation with your clients and it might not be something so therapeutic treatment related, like anything of points of interest or things that pique you in those moments, or it's someone sharing this very personal thing that's going on, document that down, take that down. And if that's something that you can build on, even better. So for example, someone's coming in and saying, hey, my uncle just got diagnosed with diabetes, right? So for example, something like that, I would jot that down. The next time I see them, I'm like, hey, why don't you take this information and then pass this on? Can be that source of information for somebody else, even if it's not directly related to that person or you just become a source of that information for a larger community.
No, I like that a lot. That's smart.
Yeah,
that's smart. So as a business owner, sir, how do you balance the business aspects with your practice and the quality of life?
I don't balance it well.
Okay.
I'm not even going to sit here and pretend I do. I do not balance it well. I have very large moments of I work way too much, but I'm also deep in my soul a lazy guy. And so I combat that with moments of I do nothing. That is like the running joke in my house is like dad wants to just do nothing. That's his goal in life is to sit in front of the couch and just watch TV all day long. So
Wait, first of all, that is not what I thought you was going to say because it sounded like you was about to say something really deep and profound.
no,
Like
no,
you said deep in my soul.
no, all surface level here, baby. All surface level. Mark is just a lazy guy deep down in his soul,
Oh
right?
God, I love
So,
that.
so I do work
Right, you work
crazy
hard.
amounts. I do work
Yeah,
crazy amounts,
you do.
but when I'm not working crazy amounts, you can probably find me sitting around doing absolutely nothing.
And that's
So,
okay.
if we go back to the idea of balance,
Right.
I don't think it's about balance.
Mm-hmm.
Balance being the scale is equal, the teeter totter is balanced. To me, that's not work life balance. It doesn't have to be a 50-50 balance.
Never is never that.
It's going to be whatever works for you. And if
Right.
you feel that you've devoted the ample time to work to bring whatever projects you have to life and make that successful, and then you also have the same amount of time that you can devote anywhere else, and for me it might be my family or my hobbies or anything like that, if I can sit back at the end of the day and say I feel like I've done a good job in devoting enough time to bring success in all of these aspects, then I've hit balance.
Mm-hmm.
And for me, that balance is not 50-50. For me, one of the big things with working for myself is I truly like to work for myself,
Mm-hmm.
which means like everyone else says, oh, I like to make my own hours, everything. I truly make my own hours.
Right.
Like if I feel like doing work at 3 o'clock in the morning, I get up and do work at 3 o'clock in the morning, right? If I feel like going home at 2 o'clock in the afternoon, I'm going to go home at 2 o'clock in the afternoon, right? So for me, the balance is between working hard and heavy and being as lazy as possible.
I love that. But you know what's so funny? So that's kind of a joke at my house too. So everyone knows I pretty much work hard. But when I find myself on that side of the couch, where that's my side of the couch, and so people are in and out and like, oh, for in a couple of hours, and I haven't left that side of the couch. Yeah, because this is my time of nothingness, of
Exactly.
watching my shows, of just being. I don't want to think about anything. So I agree. I agree,
Yeah.
and I'm also good on taking a nap.
Nice. I haven't mastered the nap part yet.
Oh man, I took a nap yesterday. I've slept so hard, so quick that because I had to go out later on, I set my alarm for an hour. When I got up, like it startled me. That's how
That's when
deep.
you know, that's when you know you needed some serious
You
sleep.
know what I'm saying? Like
Yeah.
I needed that sleep, right? And I was like, oh, do I want to still go out? But because I was like, I was like, I needed that sleep. But yeah, so I agree. I agree. But that's funny. I love that. I'm gonna use that. So what is your advice for aspiring Black massage therapists, these students who are graduating and they're coming out into the world? What
Oh,
advice would you give them?
that's loaded. One, work hard. I'm a fan of working hard. I'm a fan of committing to the job you're going to do, and I'm a fan of committing with excellence. That is one of the biggest things for me. If you're going to take on a task, you take it on with 100% effort and you execute on that as best as possible, right?
Mm-hmm.
Always room for error. That's where we learn in making
Right.
mistakes. There's, as long as we're learning from that, I never lose. I either win or I learn.
Mm.
I think if you approach a lot of anything you do, whether it's your career or your studies, I think that is a big mind piece that not enough people talk about.
I like that.
I also think working with integrity is really important. Understanding who you are, understanding your values as a person, as a therapist, if you own your own company, as an organization, and being true to those values. And that will attract people and that will repel people. You want to repel anyone that is repelled by your values.
Right.
So don't be scared that what I'm doing is not broad enough or accepted enough. I'm not gonna get enough clientele. There's enough people out there
Right.
that want what you have
Mm-hmm.
and that want it the way you want to do it. So, know who you are and build on that.
I love that. Benny has said just professionalism, right? Professionalism will take you a long way. And you broke down the types of professional behavior that you need to have in order to attract the right people and the right circumstances to you, right?
Absolutely.
So I love that. All right, so what we're going to end on is, being an educator, are there any specific educational resources, books, or courses you would recommend for ongoing professional development?
I say eat everything up. I know it's going to sound so general and vague. This is the way I see it. You can always learn something in any scenario from anybody, from anything you read, from anything you see, from anyone you've been around. Whether you are fully on board with the narrative behind, this technique or this approach to therapy, it doesn't mean that I have to turn my eye to it and pretend it doesn't exist or shoot it down really fast.
Mm-hmm.
I'm a big fan of being very open to stuff because you always have the opportunity to learn absolutely anything. So if that means take courses, if that means taking online courses, if that means hanging out on YouTube all day, and you're checking out everything manual therapy under the sun, if that means you're going to find someone to hang out with or a mentor, go for it. Go for it all. Go wherever you feel you can learn something. And guess what? You can always learn something from anybody. Even if it's just this tiny little bit off of someone dropping off all this stuff, you might think half of it's crap. And you know what? That's fine. You're entitled to think that. But even in all of this stuff and half of it's crap, you probably can pull out something like this, even if it's this big, to say, this one's going to make me think a little bit. This one I want to research more, or you get the idea. You can always learn from anybody. And I hate to see people just close their eyes to something or turn it away because on first glance, it's like, nah.
Right.
I'm like, no, how about on first glance, you just go, whoa, that's different.
Right.
That's not the way I thought. That might even be something that I believe. That might not even be something that is supported in current research. But all of this should pique your curiosity enough to be like, let me go look at this a little bit further. And I guarantee you'll walk away learning something.
Absolutely. Words of wisdom. How long you been in the industry?
Oh man, I've been a registered kinesiologist for 25 years, and I've been a massage therapist 19.
All right.
Yeah.
There you go, you guys. Listen to the man. So, little housekeeping really quickly. So, on our website, www.blackmassagetherapist.com, you have your hotel registration. Remember, you can register as a discounted rate for $165. We have king size as well as double queen size suites, so you can share with a person and just split it halfway. We also have these wonderful shirts. I am Black History, and on the back it says Black Massage Therapist. So we have those on the website. We have 2 grants, one school grant for those who are currently in school. You could apply, and basically it will pay for your registration, not your travel, not your hotel, but your registration to the 2-day conference. And last but not least, we were blessed with 2 business grants this year.
Nice.
2 business grants for $1,000. So you have the grant application on the website. We were blessed by ABNP, and also your great investment by Austria. He is actually going to be speaking at the conference too, talking about your finances. So he's blessed us with an $1,000 grant. So 2 grant recipients, but you got to fill out the application. And I think that's it. I would like to thank Mark for coming on today. And I really appreciate him joining us for the conference. And he's been a blessing to me you guys don't know, but he's been a blessing to me in person and also off camera and things that him and his wife has been doing. So I thank you so much, and I
Thanks
really
for
appreciate you guys.
Yes, thanks for having me, and thanks for joining us at the Canadian Massage Conference. And we're gonna have you back up to do a lot more things. It'll be good. I'm looking forward to it.
Absolutely. Well, we'll see you next time, you guys. Bye.
Bye.